Hello, everyone, and welcome to ACP's live remote CE offering. My name is Dan Calvo, and I will be today's moderator for the non-CE course. Today's non-CE course is part of ACP's live remote clinical webinar series, which includes both CE and non-CE instruction that has been launched to provide additional remote resources and outreach to our facility partners. The clinical services team has worked to create a high-quality remote experience for you. Today's non-CE topic is OmniStand Clinical Overview, and it will last approximately 45 minutes. Before we begin today, I would like to highlight a few key points and instructions for today's course. During this non-CE offering, you will be able to ask questions using the Q&A feature. These will be fielded by the moderator. As time permits, we will also answer any outstanding questions at the end of the presentation, but keep in mind that you may always contact ACP Remote Clinical Support at 800-350-1100, option 2, or at acp-clinicalquestions@hanger.com. We'll repeat those at the end of the course as well for your reference. You can also contact your clinical program consultant for your facility. We welcome any feedback regarding today's offerings and suggestions for what you'd like to see included in the ACP Live Remote Calendar in the upcoming months. Please take a moment to fill out the survey, which will be provided at the completion of the course, so that we may continue to improve these offerings and meet your expectations. I would like now to introduce Todd Stefanilla. He will be our presenter today. Todd is a physical therapist and a clinical program consultant with ACP. All yours, Todd.
Oh, well, thank you, Dan, and thank you to everyone in attendance today for today's overview of the OmniStand. We're going to focus on some applications using the OmniStand to address fall risk factors in the geriatric patient. With that said, we're going to get right to it because there is a lot of ground to cover. We're going to start with some of the functionality of the OmniStand before moving into the applications. Stop my share, Dan. There we go. Joe, you can just hang there for just a sec. So at first glance, we're going to take a look at the OmniStand. This is ACP's OmniStand dynamic balance retraining system. It's also called the fall-proof design. You'll kind of see how that comes into play as we go through some of the functionality and the applications. We're going to kind of start from the ground up with it undressed, if you will, and then by the time we have it all set up in full dress, you'll see how the patient can be supported based on their individual needs of postural support during any training. Again, it looks kind of like a normal standing frame at first glance, but it is far from that because it will have the ability to perform balance retraining in either the static or dynamic formats. So again, depending on the level of your patient and what their needs are, you can progress their training and their balance activities as indicated throughout. There are 4 locks on the wheels on the casters, and we do recommend that they are locked where the patient enters or exits the device and during the training. The basic support on here is such that it fits through most standard doorways. There are a lot of room treats right now, so actually this device, following proper infection control, could be taken into the patient rooms at this point to be used almost at bedside. If we look at the bottom, the first thing you'll notice is a spring resistance. That in conjunction with this upper mechanism here, which allows for increased degrees of sway. We'll talk about that a little bit more, but the resistance is typically used in one of 2 ways. You can adjust the resistance once you're in the dynamic nature of the frame of the device to provide resistance to the patient for strength training, or more importantly, depending on their level of need for assistance with certain postures, you can increase the resistance to provide more support. As they progress, you can also decrease it. There are 6 different levels, handles here. There's one on either side, and you're going to adjust those as needed. It's always recommended to start the patient out in the highest level of resistance, which would be number 6, until you're comfortable with their ability to engage with activities using lower resistance levels. Working our way up. This is another mode of support right here. This is a basic knee support. It's held in place by two pull pins. You just very easy on and off. You push down on the little orange detent, pull the pin out. Do the same on the other side, and the knee support comes out. We're going to go ahead and put that in. The proper height adjustment for the knee support is right above the level of the patella. Depending on the patient, you don't want too much pressure into the patella itself, so if they're experiencing discomfort, you may have to raise the level of the knee support up or down. The way that you raise the knee support up and down, you can see here on the side, there are markings. There are single and double lines here to mark the height of the knee support. There's an adjustment knob right here. You unloosen that, you can raise it up or down. You just want to make sure that you're symmetrical on both sides. Tighten it back down, knee support's in place. The knee support is another way that makes this a fall-proof design once the patient is in there, in conjunction with the lateral supports and the abdominal pad and the pelvic harness that will be in place. As you are comfortable or as the patient needs, you can remove the knee support to do activities such as pre-gate, marching in place. If you're using it to dual task with the Omni VR, you can remove that to do some of the gate programs that are on the VR itself. And you can do that without the VR as well. If you're working on different balance strategies, particularly the stepping strategy, which we'll talk about more later, you would also want to move this so they can take a step forward and have the appropriate balance reaction. Moving up the chain here, this right here, again, this mechanism engages the sway feature of the OmniStand. The resistance, you won't notice whether it's at maximal or least resistance until you actually engage the sway feature. Right now, it's on static, so there's no motion. So your more unstable patient who is maybe not ambulatory yet, but you're starting to work towards those things, you may start with them with any balance training or to work on standing endurance, ADL activities, and standing with it static. But as they begin to progress and as you want to challenge them more, you're going to engage the sway feature. The sway feature has three different settings. 0, which is static, number 1, which allows for 6 degrees of freedom, and number 2, which allows for 11 degrees of freedom. When I come to the other side, there are 2 adjustments for that, one on either side. I'm going to put it up to the highest. So now that you see we've engaged the sway feature, you can see how the stand itself moves forward, moves in all directions. So the patient's going to be able to move around in their entire cone of stability. So as I said, this allows for static, 6 degrees or 11 degrees of freedom. Normal range for an individual's limits of stability are 8 degrees laterally, 8 degrees anteriorly, and about 4 degrees posteriorly. So this device actually allows for more degrees of freedom, increasing that cone of stability so you can really push your patient as far as balance retraining. The best way to perform balance retraining is to push the patient to their very limits of stability and just beyond, so that in real life situations, they have the ability and the somatosensory input and the body position awareness to be able to incorporate those strategies safely. We'll talk a little bit more about ankle, hip, and knee strategy as we go along. Moving up the chain a little bit more, so now, as I said, you can see how the dynamic nature is engaged with the sway. I'm going to turn that back off for just a moment, bringing it down to static position. Up the chain here, we have 2 lateral supports. These are going to be right up against the patient's pelvis. You'll see when we have our lab assistant in here, there's a pull pin at the bottom of the lateral support to slide the support in or out, depending on the size and the needs of the patient. Again, as they need more support, you can have it closer to the pelvis. As you want more freedom and challenge the patient more with their own postural stability, you can move it away from the pelvis just a little bit. Next, we have an abdominal pad here in the middle. The proper position for the pad is going to be just about the level of the umbilicus. The way to adjust the height for the patient is here on the side. I'm not sure if you can see these very well, but there are numbers along the side, and on both sides, they correspond to each other. When you release this mechanism to adjust the height for the patient, you want to hold the top of the stay tube because it's spring loaded, and otherwise, once you let this go, it may pop up. So you just hold that down, and you can see the tension in there is going to pop up, numbers increase. You can fit somebody in here from 4 foot 10 inches tall to 6 foot 8. So it has a wide range for a lot of variability in different patient sizes and types. Weight limits on this are up to and under 310 pounds. So you want to make sure that both sides are at the same level. We're on number 5 on this side. We're at number 5 on the other side, so that's symmetrical. Again, the abdominal pad is going to be at the level of the umbilicus. And the final support mechanism, so the mechanisms on here that provide support are the amount of resistance down here at the spring resistance mechanism. You won't notice that until the sway is engaged. Right now it's in 0 position, so that's static. But that's one mechanism of support. The knee pad is another mechanism of support. Prevent the knees from buckling, keep the patient in place. The lateral stay tubes are going to provide some lateral stability. Again, then we have anteriorly, we have the abdominal support pad. And then posteriorly, this is kind of the coup de grace. You'll see this here. This is a premium harness. It has a seat attached to it. And this is the part that will go up around the pelvic, around just about the level of the iliac crest. And the seat portion is going to go just below the gluteal folds. As you are more comfortable with your patient's level of stability, you can decrease the tension on the seat portion. So you can do some activities like squatting, or if they need more support, you can increase it and cinch it right up around their buttocks. That seat will also allow the patient to sit and take a break if they need to, and it will prevent them from falling. Always recommended to have the harness on, and depending on the patient and your comfort level, you can vary the amount of tightness that's there to provide support. You can look on the harness. There are blue and orange straps, and there's an indicator on the back that tells you that the blue strap goes over top of the stay tube to click in, and the orange one goes underneath. I personally like to have one side already attached. So when we stand the patient up, either using the ramp that we'll talk about in a second or not, you can just take the other side, put the blue strap over top of the stay tube, and click it into the side assembly right here. You'll hear it clicking just like a belt buckle, and then the patient's secure. A couple more optional devices that come along with the OmniStand are the tabletop assembly, which we'll put on real quick. It's easy on, easy off. This allows for tabletop activities, but it also can add to the amount of support provided to the patient. Depending on their upper extremity, their trunk control, their postures, their endurance, you may want to add this just to give them another level of support. You can see it comes on and off very quickly, really easy. And again, now, depending on the height of the patient, you can use this for some additional upper extremity support. OTs can use this for tabletop activities. You can set different tools on here, different activities of daily living. You could have someone practice brushing their teeth, combing their hair. You could have them set up a dinner table setting, practice eating right from this level. So that's easy on, easy off. I'm glad to remove that now. One more optional accessory I'm going to show you is the ramp. There are ways to load patients on using the ramp. Either walking, you can walk a patient up the ramp, you can push them up using a wheelchair. The ramp comes in 3 sections. Each of the sections connects via a magnet, and they have cutouts to the corresponding piece that with little screw heads sticking out that can sit in there and make sure that the ramp is in proper alignment. You hear that click in, make sure it's centered. Your next piece, you can see the cutouts and the screw hole, the screw pieces that go right inside the cutout to make sure it's lined up. And the last piece being the ramp section. You can see the angle there, making it easy for patients to either walk up who can't step up, or to wheel a patient up in a wheelchair. Fits most standard 18-inch wheelchairs very nicely. You can bring the patient right up to the knee pad, put their knees there, have them hold on the stay tube to stand up. Or you could, if you have a larger wheelchair, as long as it's on the flat portion of the ramp here, it may stop where the wheels are if it's too big, but you just stop the wheelchair there as long as it's on the flat portion. Have the patient scoot forward in the seat and then stand up. You could even initiate some sit-to-stand transfer training from the wheelchair level, just like that in the OmniStand. So I think we'll have our lab assistant come out now, and then he can either, I'm going to take off the first section first, Joe. Put this here. All right, this is Joe, our lab assistant. Come on up. Wheels are already locked in place. We're going to get Joe set up. Joe's very high level, so setup is a little easier, but even if you have a lower level patient that can't stand, which I think we're going to find a lot of times in long-term care, given that roughly 35% of falls that happen in skilled nursing facilities happen to those folks who are not ambulatory. So we're going to have the patient bring his abdomen right up to the pad here. How's that feel, Joe? Not too tight, but we got it right about the top level of the iliac crest. You can adjust the straps here in the back. There's a little push mechanism to adjust each side if you need to. The lateral stay tubes look pretty well adjusted for Joe. Probably a little close for him. He doesn't need quite so much support, so we'll give him a little bit of room. If you move the lateral supports, you may have to readjust your pelvic safety harness. You doing okay in there still? Okay. He's still pretty good. More often, if you're moving the tubes in closer, you'll have to retighten those once you get the patient in. The setup for the OmniStand is one of the beautiful things. You may need 2 people depending on the level of the patient that you're putting in. All patients that use the OmniStand, this is another difference between this and a regular standing frame. The patient should have some ability to stand, even if it's with support. Right now, you can see it's supported on all sides of the pelvis, at the abdomen, at the pelvis in the back, and then underneath. We're going to keep this loose on Joe, but we could raise it up if we needed to, right up to the level of his buttocks. But we're going to keep that nice and loose so he can start some activities. You can see on the side here where these straps are to loosen. Okay, make sure all the wheels are locked in place. Yep, they're all good. Okay, so as we talked about earlier, one of the nice things about this is it's going to take a lot of the fear and need for assistance out of the clinician's mind when they're treating their patients. Again, oftentimes I've seen in the clinic, I've experienced myself, fear that when you're really trying to push a patient to reach beyond their limits or to their limits of stability, that there could be some kind of an accident or a fall just during that training. Additionally, if you think about it, the patients themselves, if they're a faller, probably already have a fear of falling. This device is going to allow them to participate and push themselves and allow the therapist to engage that patient at higher levels of intensity without the fear of falling. Additionally, as far as efficiency in the clinic, Oftentimes you'll see 2, maybe 3 people working with one patient for balance activities. You know, maybe someone's standing in front throwing a ball or tossing a balloon, and then there's someone holding on to the patient. Once the patient is set up, whether they need 2 people to be set up or not, it's hands-free. You do not have to worry about having hands on the patient anymore. They're totally securing the device. Joe is higher level. One thing I want you to keep in mind throughout this entire presentation is that we can and should, depending on the level of the patient, begin in a static position with the device fully locked, the knee pad on, the pelvic harness in place, the stabilizer is nice and tight. But given that we know Joe's a little bit higher level, I'm going to take off the knee pad now to give you a demonstration of just how far we can push patients by varying different parameters of your balancing training, changing the visual environment, changing the support surface that they're on, providing different resistance. Let's remove this real quick. Okay, right now, I'm also going to bring Joe down to the lowest level of resistance to really challenge him. I'm going to bring this up to the maximum level of sway because I know he can handle it. But these are all parameters that you can adjust throughout your treatment progression depending on what your patient needs. Okay? More secure, more postural support, less secure, less postural support that you're providing. As you can see now, Joe can actually sway himself around using what? His ankle strategy. You can see him engaging it, especially as he's going backwards, in all degrees of freedom. This is allowing 11 degrees of freedom, which is more than normal, which is a great training practice to get into, being able to push that patient. You can see as he's just doing that around, he's engaging his ankle strategy. The next strategy that's available that we use, right, when we talk about balance, and it's just being able to maintain your center of mass over a given base of support. If you're in standing, it's here, just about your belly button is your center of mass, you're trying to maintain it. That's what Joe did as he was moving around. He's maintaining his base of support as he's moving his center of mass over that base of support. In walking, we're also doing the same thing. Your center of mass is just being maintained over a moving base of support. In each of those conditions, sometimes there's what's called a perturbation. We provide perturbations as therapists to try to knock that center of mass outside of the base of support externally. But as someone is in the community, someone that is a faller or anybody, perturbations happen. A perturbation is just an external force trying to knock you out, your center of mass outside that base of support. So that could be trying to step over the dog that's walking behind me, and all of a sudden I have to move unexpectedly. My center of mass is going outside of the base of support. What do I do to correct that? I could be stepping on an escalator and all of a sudden starts to go down, and I get a little bit extra perturbation or a force that's kind of changed me, knocking my center of mass outside that base of support. So what do? We use either an ankle, a hip, or a stepping strategy. Joe has already demonstrated ankle strategy. There was a slow perturbation. He was moving himself voluntarily in his tone stability, and he was utilizing that because it was a small perturbation, and he was aware that this was happening, so he's able to use that balance strategy. That's the most commonly used one. However, if the perturbation has a little bit more force, such as standing on a bus and you're hanging out to the rail and all of a sudden the bus takes off, we engage what's called the hip strategy. So these strategies are important for us to engage with the patients to enhance their ability to maintain balance, because these are the strategies that they're going to rely on. So to engage a hip strategy for Joe, you want to provide some kind of an external perturbation. You want to do it initially. You want to tell the patient that you're going to be pushing them forward. I'm going to push you forward, Joe. I'm going to push you backwards. He's already starting to engage a hip strategy, trying to maintain his balance. Right? If I provide just a little bit more force, you see that hip strategy come in, and it's more of a reaction. It's not a reflex, it's a reaction. So as you're progressing patients throughout their training, you want to make sure that at first it's a voluntary, they know what's happening, but then tell them I'm going to do it when you're not expecting. and you want to have it become more of a reaction to really facilitate their ability to utilize that strategy. So Joe, I'm going to go ahead and push you in some different directions, and I'm going to change how fast and how forceful I'm doing it, and I want you to just do whatever you need to do to keep your balance. So you can see Joe engaging both the hip and the ankle strategy during this. And like I said, Joe's a little bit higher level, so your lower level patients, you'll get a reaction a little bit quicker with even less force. The third strategy that we use to engage, to maintain our balance is called the stepping strategy. And with the OmniStand, when trying to engage the stepping strategy, I like to put this piece of the ramp on the front. This gives them a little bit larger surface area to engage that stepping strategy. So now, same thing, Joe knows that I'm going to be pushing him in different directions. The stepping strategy is what? Once that perturbation is so large that it does knock us out of our center mass outside the base of support, we have to take a step. So that comes with a much larger perturbation, right? So if I push Joe real fast, you see him take that step. That's a stepping strategy. Okay, you can do that. You can really apply quite a bit of force to a patient without the fear that they're going to fall down. Joe is demonstrating some of the next things that we're going to talk about, which is what else can you do to challenge that patient? What can you do as far as changing the balance conditions? So one of the things that we can do are adding some external resistance. You can use the therapist can use your hands. They can use Geriatric or even a yoga strap. So if I want to provide some external resistance to Joe with my hand, I may push him back and have, come on, bring yourself back forward, Joe. Push, push, push. There you go. Good. Pull back. Pull back. I've had feedback from Joe with this before push, that this engages his core quite a bit. Pull back. There you go. Stick your butt back and pull back. Good. Push forward again. Push, push, push. Bring your hips forward. There you go. Good. So you can use your hand anterior, posterior direction. You can do lateral weight shifting. Push to the side. Push, push towards me. Push, push, push. There you go. Pull to the left. Okay, good. Come back to the middle. Right to the middle. There you go. Good. Stay there. You can do the same thing by adding resistance to your TheraBand onto the bars itself. Joe, lean to the left. There you go. Come back my direction. Lean again. Lean to the left. Good. Lean to the left. You can also let go of that resistance to see what kind of, if you can get another reaction. Lean back, Joe, towards me. Now pull forward. There you go. Come back towards me. Pull forward. Good. Relax. So that's applying some external resistance to the device. That's in conjunction with this. You can also increase the resistance there if you wanted to do some more core strengthening. A lot of research today talks about the benefits of core strengthening, especially the transverse abdominis. What they're finding is that, kind of like the old adage, proximal stability before distal mobility. What they're finding is that although patients may have similar fallers and non-fallers have similar excursion rates in their anterior and posterior excursion for an ankle strategy, a lot of times what they find is there's more sway at the end range laterally, and that comes from core strengthening. So as you're doing activities in here, and even prior to balance training in the OmniStand, you can think about doing some transverse abdominis activation using your abdominal drawing move. That could enhance their stability at their end limits of stability, as well as enhance their overall balance and fall, prevent fall. So we're talking about some external resistance on the device itself. Whether you're doing weight shifting or working on levels of stability, we talked about facilitating a ankle strategy, how you can facilitate a hip strategy, just using your manual contacts, your verbal cues. The next thing that we'll talk about is altering some other of the balance conditions. Right now, he's got eyes open. We can alter the visual cues, eyes open, eyes closed. You can put a band over their eyes to create some, instead of having their eyes closed, you could have them put a pair of sunglasses on to alter their visual conditions. You could also have them try to enhance their gaze stabilization. When you find that someone has problems with increased sway on the firm surface with their eyes open, sometimes that's a problem with gaze stabilization. And so you could have them look at a target in front of them, and then they can start to turn their head side to side while they're focusing on the target. Look at the letter B, Joe. Turn your head side to side. A little bit faster. There you go. Now just like you're shaking your head no. There you go. So you can have them do that to work on gaze stability. You can progress that as well to alter their arm position. You can have them start with their arms out to the side, making it easier. Shake your head no, looking at the target. There you go. Now put your arms down to your side. This is just a progression you can use side to side. Then cross your arms over your chest. Same thing. Each one of these levels increases difficulty and then stop. The other thing that you can do as far as changing those conditions, altering your eyes open, eyes closed. You can have them put their feet together all the way. There you go. Cross your arms over your chest, close your eyes, then shake your head left and right. There you go. Okay, stop. Keep your eyes closed. Shake your head up and down like you're saying yes. There you go. You're going to challenge the vestibular system here a little bit. Also, he's going to be utilizing somatosensory cues because he's still on a firm surface. Open your eyes, Joe. So one of the next things we'll look at is changing the support surface. You can do this in several ways. I'm going to show you two different ways. One is with a piece of foam. Again, before you do this, depending on your confidence with the patient, you may want to put the machine, the OmniStand, back into its static position. If they're lower level, you may want to have them sit down and then put the foam under. Joe is going to be able to lift up his feet and jump up right on that. So now, when we put the foam underneath, I'm going to raise that back to 11 degrees of freedom. This is going to allow us to challenge Joe differently, right? As we now have skewed the somatosensory input under his feet. You could also do shoes on and shoes off in this condition, right? You could do a thin foam if they're lower level, a thicker foam if they're higher level. So again, we can take them through the same progression of arms out to the side, eyes open, look at the target, shake your head left and right like you're saying no, good. Okay, arms down to your sides, there you go, shake your head left and right. Okay, now cross your arms over your chest, shake your head left and right. Okay, so we just took them through a nice progression there. Now, what we could do several different things. We can alter his foot position. Joe, can you put one foot slightly in front of the other one? There you go, just like that, semi-tandem. Keep your arms crossed, eyes open, look at the target, shake your head left and right. Still doing a great job of maintaining the stability. You're going to find a lot of your patients won't in this condition. This is pretty challenging. I will say Joe's also a pilot. So you have to challenge him pretty good to get any imbalance out of him. So the next thing that we can do, if I put the target back down, we can also have Joe let's keep his feet in this position, keep his arms crossed over. This is like a maximum challenge. Now we've altered the surface that he's standing on. We have his feet in a semi-tandem position, his arms crossed over his chest. Now we're going to have him close his eyes. Now we're going to have him shake his head left and right like he's saying no. Joe's doing a great job of keeping his balance. Okay, very little movement. But if he were to have imbalance, he's not going anywhere. He's still secured in this device. I, as a therapist, can just stand back and watch what's happening. Okay? So the next thing we'll do is try to challenge him a little bit more with a different surface. Let me lock these up for you. All right, go ahead and do that. We're going to use a half of a foam roll here. You can put it either way. I'm gonna have Joe stand. There you go. Go ahead and sit down on that. This is gonna be a lot more challenging to Joe. So as you'll see, with his eyes open, go ahead and put yours out to the side or just over the tubes. If the patient needs to, they can have their hand, or they can start with one hand on the tube for support, a finger on the tube for support, depending on what they need. Joe will have you put your hands out to the side, maybe just over top of the bars. Bring them down just over top of it. There you go, just in case you need to grab on. Now head side to side. There we go. Boy, he's doing great. Okay, how about up and down? Okay, good. Now let's do this. Since we have that was static, let's give him a little bit of motion here and see how good he gets. Okay, there, a little more unstable, huh? So what I'm going to do is I'm going to change this down to 6 degrees. This is good real life, right? Sometimes it's kind of a assessment as we go. I'm not sure I wanted to challenge him at 11 degrees of freedom, but 6 degrees of freedom, I think we're going to be pretty good. And I'm going to move the tube in a little bit closer, give him a little bit more support, and then tighten up these straps. You feel pretty good in there? Good. Okay. All right. Much more demand on him as far as postural stability goes. Go ahead and move your head and eyes left and right like you're shaking your head no. Doing pretty darn good still. All right. Now how about up and down? Okay, good. Let's take him up to 11 degrees. Okay, try to put some weight back on that left heel of yours. There you go. There we go. That's going to get him a little bit more. Just work on getting your balance. Good. Now shake your head left and right. There we go. Now we can see that we're challenging Joe a little bit more. We finally found something to challenge him, right? So this is where we want to stay for a little bit. Shake your head left and right. There you go. Good job. Up and down, and then stop. So sometimes it's a game of trying to find out what is going to challenge your patient more than others. That was good for, we're addressing many things here. Gaze stabilization, we're working on some lower extremity strength, even some lower extremity range of motion, working on a little bit of the hip and ankle strategy all at the same time. So we're definitely multitasking with this. Let's go ahead and step off that. I'm going to remove this. I think we're running kind of close to the time, so we'll spend the last few minutes doing some multitasking with the OmniVR. So I'm going to go ahead and, even though this is not recommended for a transport device, but we have it in the static position. Joe is secure in there. I'm comfortable. So I'm going to go ahead and actually we'll leave him like this at first. And we're going to have him do some upper extremity activities, maybe the carnival game or the carnival protocol on the OmniVR. So let's go to exercises, carnival. We're going to do throwing and standing. We'll give Joe, put him on moderate, probably could do maxed. We'll just do a little bit of treatment time, maybe 45 seconds. Let's start. Joe's familiar with this program, so we're going to let him go to town. It looks like we're a little close to the VR. We'll move him back. Again, real life, you may have to make some adjustments during your treatment, but the nice thing is it all happens pretty quickly. All right, Joe is in position. I want to put the wheels back up. So now we can engage him and some upper extremity activities. Go ahead and hit that thing. There you go. So we have him engaged in upper extremity activities again while he's secure in the harness. At maximum degrees of freedom. We can also, I'm going to go ahead and stop this one. We're going to pause it. We can also have him to upper extremity. We can also have him reach to the side, reach up and touch my hand, reach way out. There you go. Okay, try not to move your feet. Do what you have to keep your balance, but keep your feet in place. Reach my hand way out. There you go. Left arm way up. Good. Left arm over here. Left arm. There you go. Right arm over here. Good. So we got some more upper extremity activities. Depending on the patient, you can do some ball toss activities. Throw the ball. Again, hands. This is hands-free for the therapist. No need for a second. No need for a second therapist to monitor the patient. Okay, as you progress the patient, this is not only good for upper extremity motions, but also good for your eye gaze stabilization and changing the visual conditions as well. We went from a big ball, now we're going to do a little ball. Again, a little bit more challenging. You're going to do this based on the patient itself. Okay, so we got some ball toss activities, some more upper extremity activities, working both upper extremities and gaze stabilization. We can work some hip strategy using the VR. I think this will be one of the last things that we're going to do here. I'm going to put them static. We're going to turn this around. And we're going to engage in a different activity. And we're going to do the, we're going to do a puzzle. Where you find it. There's the puzzle. So Joe, this is going to be the one standing where you are going to put the puzzle pieces together. So you're going to be going forward and backwards because we've turned the OmniStand around to work his hip strategy a little bit, giving the ability to engage hip extension and flexion. We're going to release the tension here. Also, if you notice, looking to the side, he has also an altered head position. So you can also turn him in the other direction if you want him looking left, looking right. Right now, we're going to have him looking left. And we're going to engage with one of these puzzles, do the rooster. So Joe's just going to lean to whichever piece of the puzzle goes to the corresponding spot here. So if you look up here, there's a piece of tail. There you go. Oops, let's get slapped back in. Always have the OmniStand locked. All right, Joe. There you go. Reach way back, lean way back. There you go. Lean way forward. Lean out there. There you go. Wrong piece. So again, you can see how we're using this ankle strategy, a little bit of hip strategy, bending forward. Do one more piece there. Just a good example of how you can multitask and do dual task training with the OmniVR. You can also incorporate pens to the ankles if you would like during any of this training or beforehand to enhance what you're doing in the OmniStand. And with that, I think we're going to shut this one down, Dan. There are some collaterals that are available if you need. There's an OmniStand quick reference guide, some documentation recommendations, and a OmniStand crosswalk between the OmniStand and some functional outcome measures that you may use during your assessment of your patient. If there's any questions, I'd be happy to answer. And thank you for attending today's seminar.